This is a case of mesh infection after a previous laparoscopic inguinal hernia repair performed 5 months back. This patient was referred to us for further treatment from a peripheral center. He complained of pain in the right groin and also fever with chills. So a CT scan showed a collection in the groin region. About 200 cc of fluid was there, and also the mesh was floating. Even his WBC count was high. So in view of infection of the mesh, we took him for laparoscopic explantation, that is removal of the mesh. We do get some patients like this who are referred from a peripheral center for further management, and most often we either remove the mesh or put a pigtail. Many a time we are not successful in putting a pigtail because the infection is not completely eliminated. So for a mesh infection, it's always important to remove the mesh if it is not responding to antibiotics or pigtails. Most of the time we end up in removing the mesh. Here you can see there is bowel adhesion to the area of the mesh infection. One has to be very careful, and you can see the pus coming out. You can see pus coming out, and a suction cannula is put inside to suck out all the pus. Generally there will be a cavity in which the mesh is floating. So here the entire pus was removed. Pus was sent for culture and sensitivity, and the mesh is slowly separated from the adhesions and then explanted. Here the bowel is adherent to the area of the mesh. Sometimes there will be fistulization, that is the fistula between the mesh and the intestine. One has to be very careful not to miss that, and be gentle. Do not pull the mesh. Sometimes the vessels may lacerate and there may be torrential bleeding. Be gentle with the bowel also. Don't pull on the bowel may open up. So be careful and not to miss any fistula with the bowel and the mesh. The idea here is to remove the foreign body. So if you don't remove the foreign body, that is the mesh, the infection will not subside. Many a time attempts to salvage mesh infection are futile despite adequate drainage of pus, giving antibiotics, taking culture sensitivities and giving appropriate antibiotics. Despite all these things, many a time it will persist as a sinus. So when we end up in removing the mesh. Thanks for watching. Thank you so much.